It's within the larger healthcare system. And I will be the first to say, I've never met anybody in healthcare who is trying to treat patients just to make a buck. I don't think the individuals within the system are operating with those incentives. Yes. However, the way the system is set up, those incentives exist. And so it's makes more sense as a hospital to keep your beds full than to have empty beds. It makes more financial. It makes more sense to have a busy OR versus a lot of white space in your OR schedule. And again, I don't think anybody is out there, replacing knees when they don't really need to be replaced, but there is an economic incentive that says we do better financially when we perform more services. Is the exact opposite for groups like PACE and other at-risk primary care, other at-risk models, even in specialty care, where we only do better if we address the root cause and we keep people healthy and in their homes and out of these more acute spaces.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Craig Worland, who is the Chief Operating Officer at One Senior Care. Craig, thank you so much for being here today, and welcome to the podcast.
Thank you for having me.
I'm excited to have this conversation, just as I am with every single one of these. As I just told you right now, it never gets old. So why don't we start off with you just telling everyone a little bit more about One Senior Care, who you guys are, who you hope, and any other context you'd like to share for the listener.
Yeah. So One Senior Care supports PACE organizations across 3 states, Pennsylvania, Kentucky, and Ohio. And what PACE is, it's an acronym that stands for Program for All-Inclusive Care for the Elderly. It's a healthcare program that's focused on seniors who are eligible to live in long-term care, but would prefer to stay in their home. And so it's a large program. I'm sure we'll get into the details. Across the country, has been around since the 80s, actually, within the West, but is growing in popularity as more and more seniors are realizing that they would prefer to stay in their homes and in their communities versus going to a skilled nursing facility or another long-term care facility.
That's so interesting. And with that as well, I would assume you guys actually don't have any physical locations either, because or is that completely incorrect?
Yeah, I think it's a fair assumption, but it is completely incorrect. So I'll dive in a little bit. So yes. What a PACE program is it does have a brick and mortar center, and that's really the hub for what we do within these communities. And within that center, if you walked in, it would look very much like an adult day center, or a kind of activities center in a nursing home. It's got tables. We serve meals there. There's socializing. There's activities that go on. And our participants will come in and they will get to spend time with their fellow participants there, as well as receive meals and other services. What makes ours unique versus maybe adult day centers is that we have a really robust primary care clinic that's attached to that center. And we're staffed with a full-time provider, as well as full-time nurses who are really there to help address any clinical needs that our participants have. Along with that, we have a therapy wing. So we have occupational therapy and physical therapy in all of our centers. So that's the hub. That's the brick and mortar center. Everything else, though, you're exactly right. We do provide through the door transportation, meaning our drivers will go in, sometimes get our participants out of bed, get them cleaned up for the day, and get them into the van and to wherever they need to go, whether that's to our center or whether that's to another medical appointment or a community event. They're able to do that. We also provide skilled and unskilled home care, food and nutrition services, and social. We have a master's level social work on our staff in every single center. So it really is all inclusive, and it's the most. I've been in healthcare my entire civilian career. I was in the military first, but outside of the military, I've been in healthcare and never been around a team that's more comprehensive and really provides the wraparound services like PACE does.
Yeah, no, that's really awesome. Thank you for clarifying that as well. And it's interesting to see how being able to, I'll call it, this is going to be a very simplistic way of putting it, but hitting things from every single angle. Yeah. So they can go to this single location, they can have that in-care home help, they can have that transportation, whatever it is that they need. It's really that all-around, well-versed solution for these seniors to, I guess, kind of live in a way that frees them, like, right? Instead of being stuck to either being at home and not being able to do things, or feeling like they don't have that sense of community. Like, no, they can do all of these different things, which allows them to live a better and, of course, happier life as well.
Exactly. I say PACE in general, it's a win-win-win. So as we talked about, it's a win for the participant in that they're able to stay in their homes and stay in their communities when otherwise they may not be able to, or they would try to and would end up needing to be utilize the emergency department or inpatient or acute facilities more than they do with us. So it's a win for the patient. It's a win for the taxpayer, and that this is a significant cost savings program for both Medicaid and Medicare dollars. And I can explain a little bit how PACE is funded in a minute, but it especially right now with all the focus on Medicaid, we're as PACE, we're actually feeling fairly bullish about this because we think it's an opportunity for us to stand up and demonstrate how we are saving Medicaid dollars, and we're doing it by keeping the patients where they want to be. And we think that's a significant opportunity for us. And then the third win, which oftentimes gets forgotten, is really for that participant's caregiver. Oftentimes what we see, and if you've had the experience of being a caregiver, you sometimes have to take off of work, but you definitely are kind of removing yourself from your normal routine, removing yourself from the community. And for most of us who had the opportunity to care for loved ones, that's a beautiful thing that we would gladly, we wouldn't trade for anything, but it is hard and it's a burden. And what we're able to do with all the wraparound services is relieve a lot of that burden for our participants. So, for our participants' caregivers. And that's that third win that I think is what makes PACE so unique. And so,
yeah, no, it's awesome. That's awesome. Thank you for sharing that. I would love for you to actually dive into a little bit more on how you mentioned the Medicaid gets funded through, and also tie into, actually, we'll start with that. And then I'll ask a follow-up question within there.
Yeah. So PACE is a fully capitated payment model. So that taking more and more risk has become popular within primary care. There are several large companies that have done very well operating primary care where they take full risk on the premium dollar, meaning they get handed a lump sum of money, and then they're responsible for all of that patients, or in our case, all of those participants' care needs with that lump sum of money. And what it does is it incentivizes you to really address the root cause and not just treat a symptom that you can then bill a CPT code for. We can do things like put HVAC units in our participants' homes if that's something that they need for their healthcare. We've bought fridges for our participants because they're diagnosed with diabetes. We know fresh fruits and vegetables will help them manage that, but they didn't have a way to keep it. And so we're able to put a fridge in, and suddenly you see their A1C drop because they're actually eating more. They're eating healthier because they have the ability to do so. So we get one payment from Medicaid for our participants that qualify for Medicaid, and one payment from Medicare for our participants that qualify for Medicare. And participants qualify for both, we get a payment from each. And then with that, we manage all of their healthcare costs. So if the participant needs an acute stay in a hospital or visits an emergency department, we get that claim and we pay that bill just as normal Medicare or Medicaid would, but it's paid with that lump sum. So if we don't do a good job, and this is what I love about it, and love about really just healthcare providers who are willing to take risk on a financial standpoint, it aligns those incentives to where we only do well if we actually do well by our patients and our participants, versus doing well just because we can treat a certain volume or we can perform X amount of services. So it really is, that alignment is the thing that I've been searching for in my career within healthcare, and this is the most aligned I've ever been.
Yeah, and that's exactly what my follow-up was going to be when it ties to that, because we briefly spoke about this when we had our first conversation, and I found it so cool because now I think there is I may be overstating things here, but there's a general public consensus of like, oh, people just care about not really fixing the problem, but more so putting band-aids and keep getting that revenue coming through in that way. Whereas opposed to you guys and a couple other companies that I've spoken with now, which has been greatly refreshing to hear, is you grow by helping others. It's not just adding on services and features and unnecessary things for the sake of adding and just getting the cash. It's, hey, if we help them, then we become more successful. They have a better impact. They have better lives, but also our company grows, which means we can impact even more lives. So it just trickles on a positive cycle from there.
Exactly. Yeah, exactly. It's within the larger healthcare system. And I will be the first to say, I've never met anybody in healthcare who is trying to treat patients just to make a buck. I don't think the individuals within the system are operating with those incentives. However, the way the system is set up, those incentives exist. And so it's makes more sense as a hospital to keep your beds full than to have empty beds. It makes more financial. It makes more sense to have a busy OR versus a lot of white space in your OR schedule. Where and again, I don't think anybody is out there, replacing knees when they don't really need to be replaced. But there is an economic incentive that says we do better financially when we perform more services. Is the exact opposite for groups like PACE and other at-risk primary care, other at-risk models, even in specialty care, where we only do better if we address the root cause and we keep people healthy and in their homes and out of these more acute spaces. And so we story after story we get most of our participants are some of the most complex and costly patients within healthcare. Go off on a little bit of a tangent here, but the healthcare expenditure bell curve is the same within the US, is kind of the same across almost all populations I've seen, which is there's a very small percentage of patients on the far right of the bell curve that consume the vast majority of the healthcare expenditures. It's oftentimes something like 5% of your patients are using 50% of the healthcare dollars within that bell curve. And so what we're focused on are those 5%. And we're taking them from visiting the emergency department 12 times in the year prior to where they only had to go 3 times this year. And that delta is where I talk about that win for the American taxpayer. That's where we're creating savings, because when we're incentivized to do that, we're keeping them out of the hospital and we're getting good healthcare outcomes and good financial outcomes at the center. And it's unique.
Yeah, no, that's really, really cool. Thanks for sharing all that as well. And I'd love to kind of shift the conversation a little bit more towards the One Senior Care itself, the growth of the company, and how that starting point even comes along. Because I'm assuming there are many physicians and things that are aware of you guys who recommend, but also some people who might not be aware. So where's that starting point for the seniors or for the family of these populations to understand who you guys are, become aware that you exist, and then I guess implement their loved ones into what you guys are providing?
Yeah, so PACE is a pretty large public-private partnership. So there's only 33 states plus the District of Columbia offer PACE today. So there are still 17 states that don't even offer PACE. So if you live in one of those states, you're kind of out of luck. And then even within those states, not all markets are served. And so it's very, in most states, the vast majority of the states, you're assigned a market, whether counties or zip codes, and you can only serve seniors within that market. And so what the first step is, if somebody's interested in for their loved one to be able to be part of PACE or themselves to be part of PACE, is they need to understand, is there a PACE provider within their geography, within their market? If they do, then it's just a matter of kind of understanding who that is and reaching out with a phone call and saying, hey, I'm interested in this for myself, or I'm interested in this for my mom or my dad or my grandfather or grandmother. And I would love to learn more and see if they would be eligible. And then there's an intake process that they go through. Participants are only able to enroll in the first of the month. So oftentimes, like right now, here at the end of July, we're getting paperwork signed, and the participants who we've been working through the process this month are finalizing and will be enrolled on August 1st. And then for new programs to exist, we have to be awarded those markets from the state. And so it oftentimes is a multi-year process. We just opened 3 new centers in Ohio actually last week. And that was a 3-year process, all the way from the state of Ohio issuing a request for a proposal, us proposing what we were going to try to do, and then being able to actually open doors and serve patients there.
Sounds like a fun process to go through 3 years. That's an interesting one. And tell me a little bit more, other than what you just mentioned, which can be, I guess, the long cycle to make things happen. What are some of the other challenges that can come through to keep the company growing, but also as a result of that, increase the impact that can happen in a lot of the population, the senior population as well?
Yeah, the list is long. I'll try to keep it real short. One is there is a lot of bureaucracy and what I would call kind of hoops you've got to jump through, and a lot of that is rooted in really good things, and the regulatory agencies trying to make sure that the PACE organizations are taking care of the participants in the way they should be. So the intention is very good. Sometimes how that gets applied creates some real challenges for the PACE organization to be able to actually do that and serve the participant in a quality way. And sometimes they're, I've seen, as I've gotten to know this organization or this industry, there is this kind of concern within PACE largely, not necessarily in our organization, but within PACE largely, that things happen to check the compliance box, if you will, and they're not always done when at times it'd be better to be able to do things just to take care of the participant and document it in a way that a common person like you or I would be able to read, but oftentimes doesn't necessarily meet the criteria of a regulatory. So highly regulated, again, with good intentions, but that does create some challenges in the way we serve participants. I think from a growth standpoint, it's kind of what I talked about. It has to be awarded by the state. It's oftentimes a long process. You have to win that market. It's oftentimes competitive. And then you have to really go through and do things correctly. And then it's capital intensive. You're opening, a $10,000 to $20,000 or square foot center, $10,000 to $20,000 square foot center. That's millions of dollars. You're having to staff it with this 11-member interdisciplinary team. That's a lot of staffing costs out the gate. And you're having to do all of that before you even get a single participant. And so the capital requirements to do this are kind of bar just a bootstrapped entrepreneur to be able to go and open a PACE organization. They really need some institutional funding, or they need to be part of a larger organization that could subsidize for the early years. Once those get open, though, and if they do a good job, as we talked about, of actually taking care of the participants, these centers can be profitable. They can sustain themselves and be able to sustain future growth. But there's about a 2 to 3 year, depending on the market and how quickly you ramp, timeline to be able to hit that point. And that's sometimes too hard for most entrepreneurs to be able to.
Interesting. Do you think that and this just might be my, I guess, ignorance in this in the field and how things function a little bit more on the back end. Do you think that can also be, or do you think that part of that is also from, I guess, a lack of awareness that something like PACE organizations exist for a lot of the population? I think maybe some of the common misconceptions might be that it's just the senior homes and maybe some different facilities, locations that exist out there, but to understand the full-on difference of what an organization like what you guys provide can sometimes, at least from my perspective, not be top of mind for people, or people might not even be aware of it.
No, you're spot on. I refer to PACE as kind of healthcare's best kept secret, and I don't think I'm unique in that, in referring to it that way. It is oftentimes, especially when you get to that point where you need that help, it's not front of mind. Again, kind of going back to some of the barriers, we're very limited in the way we can market, and so getting our name out there and explaining who we are and what we're doing is sometimes challenging. People hear PACE and they think you're running a race or something. They don't correlate this to senior care. Yeah. And so trying to explain what we're doing and how we're doing it can sometimes be a barrier. That's why I appreciate being able to come on podcasts like this and being able to share, what I do think is the best kept secret in healthcare, and that more people hear about it.
So yeah, I'm always happy to give the platform to people like you guys as well. And it's really great to get so much of these insights. It's really exciting to learn a lot of these new things, but also being able to provide the platform, even though we're still a small podcast, like over 150 episodes, but still, I guess, a small podcast in that sense. Being able to provide that is something that we're always happy to do, because at the end of the day, if we're helping each other, then we're helping. We're being of use to each other as much as possible. So always happy to do that. I have one final question here for you, Craig. And funnily enough, it's actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. Okay. Here's the question. You ready for it?
Yeah.
Here it is. What is the scariest decision you've had to make since starting the role you are in right now?
So that's a good question. My initial answer is not necessarily since I started this role, and I'll have an answer.
Okay.
For but was really stepping into this. For me, I learned about PACE 6-7 years ago, and I've just been enamored with the model. Thought it was too good to be true, and left a company that I loved and was doing well at, and did kind of what every career counselor and parent would advise against. Said I want to do PACE, and I'm going to take a jump here and try to figure out what that means. And fortunately, was able to land with One Senior Care, and they've just been phenomenal to work with, and I love being part of this team. But that was a scary decision at the time. I think internally, or since I've been in this role, really it's trying to understand where to expand. We have a very specific rural focus and a thesis around that. There's just a dearth of healthcare services. Most healthcare services are migrating out of rural areas as the younger population migrates out of rural areas. So what you're left with is an aging population that does not have access to quality healthcare. So when I think about where do we go next and where do we implement these centers, I have to be selective for the capital intensive reasons we talked about earlier. But I think about, like, I live in a rural setting. I grew up in a rural setting. So I think about, what if when I'm looking at a map, or when we're looking at a map, I don't make the decision in a vacuum. When we're looking at a map and I think about, do we go to community A or community B? I think about my grandparents, and I think about my parents, and I think about, my neighbors here in my community here, and say, I'm having to choose between serving this community or this community. And ideally, if we do this right, we're able to serve everybody. But am I in their backyard? No. And so that, I think, is always a challenge for me, is because I take it very personally, and I want to make sure we're able to maximize the value we bring to these rural regions that we serve. So,
well, that's interesting. I thank you for sharing that. And it's really awesome, because I think in a way it allows you to really step into that family's shoes, because you are that family in a distant but also very proximal way. Because if you're trying to look at it from a lens of how can I best serve them, then that's what you're doing. And I think that's what allows the value to come through in its highest ways possible. So amazing, Craig. Thank you so much. This has been such an incredible conversation. I really, really appreciate you sharing all your insights, jumping on here and really showing the value of what you guys provide. Where should people go if they want to learn a little bit more about you, and of course, also a little bit more about One Senior Care?
Yeah. So I really don't have much social media. I do have LinkedIn, and I'm pretty active there. So happy for people to connect with me on LinkedIn. And then oneseniorcare.com is our website. Would love for people to connect there. And then if you are in Western Pennsylvania, Eastern Ohio, or Eastern Kentucky, would love to connect to see if we can partner from a business to business standpoint, or if you have a loved one or yourself would be interested in learning more about PACE services, please reach out, and so we can connect there.
Amazing. I will leave everything down below here in the description if you're watching this and you want to check any of that. Also, if you enjoy this conversation and you want to hear more conversations like this, please hit the subscribe button, and I will see you on the next episode. Craig, thanks again one more time.
Thank you.